Cardiac disease is the #1 killer in the world, and valvular disease is more and more common as we get older. So this study is looking at how we can determine how well will the heart squeeze after the valve has gone in, and then predict when we change out the leaky valve to the perfect valve, will the heart cope with it? And that allows us to predict and prepare before we start that procedure. What this technique is putting a wire in a tiny hole at the top of your leg and feeding the wire up the whole way towards your heart under ultrasound guidance, and being able to essentially put paper clips to bring the floppy edges together. And it stops the backflow, it allows the heart to recuperate, it allows you to breathe more easily, and it allows you to go and do normal things. But we need to understand better how the heart will cope with it and which patients are suitable. And the more we understand, the better we can get the technique, and the better a cardiologist like Dr. Raffel can help your mum and your dad.
The ultrasound itself is completely same, but the difference is that the software to analyze the echo image advancing, we can get more detailed information from the simple images.
The question is, if this valve is leaky, we want to predict before we put a competent valve in how well the heart will cope. And the way that we do that at the moment is got many problems, many assumptions, some of which are correct and some of which are not. Again, this is supplemented by brilliant clinical expertise from a cardiologist at St Andrews.